Conquer Cancer Foundation looks at clinical researchers in particular and looks to say, not only getting at the fundamental mechanisms of disease and new therapeutics, but they also look at, okay, how can we get to the patients and help patients in the here and now to get better care or have better access to care, and how can we understand that? And I think that's where the Conquer Cancer Foundation really makes a critical difference in moving the field forward in terms of patient care. One of the things that got me interested in breast cancer, and breast cancer in young women in particular, was when I was 30 years old and my best friend was 30 years old, she was diagnosed with breast cancer. You know, everybody says breast cancer is rare in young women, and if you do the math, it's about 1 in 250 women will develop breast cancer before they're 30. And my high school class was about 250 people, and sure enough, that 1 in 250 ended up being my best friend. Yeah, it was a huge motivator because I saw such a need. She was looking for information, she was looking for answers, and I was the researcher who could scour the literature, and the answers weren't there. So I decided that we needed to find some of those answers, and that's what set me off on my research path. So I've been funded now by the Conquer Cancer Foundation of ASCO 3 times. In 2001, I received a Young Investigator Award. The second award that I received was a continuation of that work. In 2003, I received a Career Development Award from the Conquer Cancer Foundation, also focused on sharing results with patients who had participated in clinical trials. And that was actually a groundbreaking piece of research that we were able to accomplish thanks to the Conquer Cancer Foundation for funding it. I've been very fortunate, and I've been funded by the Conquer Cancer Foundation for an Improving Cancer Care grant, which is funded by Susan G. Komen for the Cure. And my grant is focused on improving the care and outcomes of young women with breast cancer. We've developed a program to help them through and beyond breast cancer, both early on in their diagnosis to target their unique needs like fertility and emotional needs, and well into survivorship to help them live as well as possible. We've now been funded by ASCO Conquer Cancer Foundation to develop a virtual program which will help to take our program throughout the country to community centers. So this grant really serves as a model for improving the care of patients who have unique needs, not just at a large cancer center, but at community sites.